Hello, North Dakota, and welcome to our daily press briefing. Got some good news today, so a little lighter day maybe today for all of us, but want to start off right away with the news. Today, the Department of Health confirmed 14 additional cases of the COVID-19, and this is comes on a day when we had our record our record number of tests taken, 835 tests taken, 14 over 835, 1.6%. That's our lowest we've had in this thing, and what that means is we continue to have a very flat, in this case even declining rate. Now we understand, and we'll talk this in a little more depth as we go through this, that we did do some of these numbers included in here are from Operation Drive-Thru, which we did in Western North Dakota, where we were doing more broad-based testing of people that didn't have symptoms. So the pool of people that we were testing was perhaps a less of a target audience, so likely that we would have a lower percentage, but we did learn some very valuable things out of that test, which we'll cover. But the other piece right in the lower center of this graph, which I want to highlight, is also that 16 currently hospitalized. This is good news that we're down 2, so 2 more people that are out of hospitalization. And this is a number we'll continue to highlight in the weeks ahead, is number of hospital beds, because again, from a strategic standpoint, the whole point of everything that our country is doing to try to reduce the spread was to not get in the position that we saw in Italy, that we saw in the New York metro area, where you were actually an area ran out of medical care. And when you run out of medical care, particularly at the highest level of licensing, when you don't have enough ICU beds or in intensive care, critical access type caregivers that can manage that with all the sophisticated equipment, that's where you can save lives, is at that high end of care. And so again, trying to make sure that we can deliver the best possible care to all North Dakotans that might need it if we have a spike due to this highly contagious and for those that are older or have underlying health conditions, a highly deadly disease. But the good news is then, as we've said before, we know that we've got at least 2,600 beds identified in the state, and you're going to hear plans about how we're going to scale up from there. But again, 16 over 2,600. This is less than 1% of the beds, hospital beds in the state of North Dakota are currently being used for COVID. And so for those that think that the state isn't doing enough to slow the spread, I would ask them again to keep looking at the numbers and understand what we're trying to manage, which is we're trying to manage capacity of hospital care. This is the 2 curves we talk about. One is the curve in the line, flattening the curve, which we're doing, and then raising the line for the hospital care. So then the other piece, which and we'll get to in a second in 2 slides, but let's just take quickly look at the number of new cases, the raw data, the numerator here, which again shows that the 12 cases that we reported today. But if we go to the better piece of data where we're taking positive cases versus tests taken, this is the positive test rates. Those remain low, and because of that wider spread testing over the weekend, you're actually seeing that curve flatten out. By comparison, again, for those that might be watching and are nervous about what was going on in the New York metro area, both New Jersey and New York had positive test rates in the 40s, like 40 to 46% of the people tested were positive. When you're in that situation, and with the possibility that every person that has it may infect 2 more, that's when you get into that exponential growth. That's not where we are right now at all, and it certainly shows that on the next slide that we have. And this is our slide that shows, again, above the line is the active cases that we're managing. Below the line is those that have recovered, or those that sadly that have passed away due to the COVID-19. But you'll see, if you net out the new cases that we had for today, the 14 new cases versus those that have recovered, we actually went down we actually went down in number of active cases. That's the first time that this has happened, that active cases have gone from 54 to 53. So super encouraging news that we at least had one day on our march. Most other states have seen this line continue to just climb skyward. But again, given the lagging aspect of the data, I want to just say thank you to everybody that's been practicing all the guidance that we've been given, because we're benefiting today from actions that people were taking several weeks ago, whether that's closing schools or businesses or personal care businesses. All of that reduced activity is paying dividends today. And so one other piece of data that we want to address too at the front end here is relative to rate by counties, because there has been some concern. I think people get stuck on the numerators where we see stuff on social media, which is, hey, how come we're not doing more for Cass County? Because Cass County's got the most number of positives. Newsflash, Cass County is our most populous state. Okay, so when we get done with this, we are likely going to have the most number of cases in Cass County. What we're really managing in terms of what's a hot spot is whether or not the cases that you have, the positive cases, over the tests that are taken or over the population. So this is the positive rate. And you can see on the slide here on there that with Cass County at 4.3% is got a far lower rate than some of the counties that we have in Western North Dakota, particularly Montreal, which jumps out at almost 17% rate. So again, that's where we're focusing some of our task force and strike teams right now, is into Montreal, and working in conjunction with Chairman Mark Fox, Dr. Monica Mayer, and MHA Nation, Scott Sattermo, the whole team up there that we're working with, again, to try to make sure we're addressing the outbreak and we're working there with all of the tribal officials and local officials there to make sure that we're doing a great job working together to protect everybody in North Dakota. So again, we're doing a great job on getting testing done. There has been tests now taken in every county. If it's white on this slide, that means there's not yet a positive in that county. If there's no numbers in that county, those are the counties that don't yet have a positive. That doesn't mean that there isn't COVID disease in those counties. It just means we don't have a positive test case yet, and we'll talk a little bit more about that. But I think next up, I want to talk a little bit about our guidance that we keep giving, that we want to repeat every time, which is what we call North Dakota Smart. And again, this is what's working. So today, again, this is just a thank you to everybody that's doing these things, avoiding discretionary travel. When people have an opportunity to go to the grocery store, don't make it a family outing. If you can, send one person with a list, even better yet. If some places are still doing delivery, or you can get pickup at the order online and go pick it up. I want you to get into the gathering in groups of 10 or more. We know that, again, we're social beings, but again, gathering in 10 or more is part of the guidance that we're giving right now. We want to restrict that. Again, following state and local authorities, whether it's, again, thank you to all of the business leaders, business owners that are doing the hard work of closing their restaurants, their bars, their gyms, and other places. You're all making a difference. You're all heroes, and you're all saving lives. Again, the CDC guidance this week, we're seeing more and more of this happening, which is great that it's becoming commonplace here. That everybody is wearing cloth face coverings when out in public. I'm sure that one of the things that we're going to see when we talk about the new normal, I think a lot of us, when we grew up as kids, none of us ever knew what a bike helmet was, never wore a bike helmet. People that ski didn't wear helmets. And now, sort of the world we're living in, it's a lot of people wouldn't understand that for your kids, it's smart for them to be wearing a bike helmet. When you're skiing, it's great to be wearing a helmet. I think for a while, coming out the backside, we're going to see masks as part of the new normal as we get back to work. And so people that might be putting that off, I'm sure there is, as we speak right now, all kinds of fashion masks being produced, camo masks, reproduced Halloween masks, whatever it might be. I'm looking around the room today. There's some colorful ones in the room that are out here today. So again, we just want to say that that is another way to protect yourself, your family, and others. And there's a lot of stuff online. If you say, hey, where do I get a mask? Can't afford a mask. Even the CDC's got videos on how to make masks out of T-shirts or cloth or sheets or rubber bands. There's a lot of ways to do it, and where it can even cotton covering can make a difference. Again, one of the big ones, which we think is working, this message is getting through, but if you're sick, stay home. If you got symptoms, cough, sneezing, temperature, stay home. If you feel that you need your condition, of course, call your medical provider. And those others that we really want to make sure that we're helping them avoid contact is the older Americans who've got underlying health conditions or risk. I hear every day great stories about people that are taking care of their parents or their neighbors, so that those people that are more vulnerable don't have to go into high contact situations. And again, practicing great sanitation and hygiene habits. One way to stop community spread is with hand hygiene. Again, if you're touching anything that is what you'd call a public location, people keep asking, why do I keep mentioning ATMs and gas pumps? Well, long before the pandemic came around, there was a study that was done about where germs collected in America and places that lots of people touched, but were never often sanitized. Guess what was number one and number two? ATMs and gas pump handles. So there's actual data behind that as well. So anyway, but if you're grabbing the door, going into a supermarket, again, whether you're wearing gloves or using a hand sanitizer, or washing your hands, all of that's really important to avoid the spread. And again, if you think you've touched a common area, the advice then is make sure you're not touching your face, because that's how you could transfer it from a surface to your hands and into yourself. Anybody that knows anybody or has talked to anybody, and I've had a chance to visit with some friends last night, 2 friends last night in other parts of the country who had friends that have passed away from this disease, other people that have not passed away but have gone through this illness, been hospitalized and come out the other side. And I want to, again, if you're not in a position to know anybody that has either died or been sick from this thing, I would encourage you to really get up to speed, because this is not something that anybody would ever want to have. I mean, this is people describe this as, someone in the later stages, there's someone putting a pillow over your face and smothering you to death, because it is affects lung capacity and breathing capacity. So again, really deeply grateful for all the people that are taking this deadly disease serious and taking care of those around us. So again, what we're doing here in North Dakota, targeted action, smart action to slowing the spread, flatten the curve, we're saving lives. That is working. And again, there still continues to be some murmur out there. I thought perhaps that we had that some of this was stopped after Dr. Fauci on Monday talked about states like North Dakota. What we're doing is functionally equivalent and totally compatible with other states' orders. So we know that the numbers speak for themselves, that it's working here. And again, we have from the start said that this isn't as much about what government says, it's more about what individuals do. And we continue to applaud and acknowledge that North Dakotans understand that they have an individual responsibility, and thank you all for taking that individual responsibility seriously and exercising all of these smart practices. Next up, I want to talk about Operation Drive-In. As you heard earlier, we had 2 locations on 2 days, Saturday in Amidon, Sunday in Gladstone, North Dakota. In Amidon, North Dakota, 367 samples were collected, in Gladstone, 368, so about equivalent in both of those. In Southwestern Public Health, North Dakota National Guard, and people in Slope County, Gladstone Fire District helped on Sunday. One of the reasons why we did this, why did you do this? We wanted to test people more broadly across the community, people that were not showing symptoms. There had really been almost none of this done in the entire U.S., and at least in North Dakota, we saw an opportunity because the time we selected Slope County, at that time there wasn't a positive in the county. By the time we got there, there was one. But one of the things we did learn was that we had 3 positives in Slope and 3 in Gladstone. Half of the people that we tested there that came back as positive had no symptoms. So I guess I would just say we take a look at the numbers that we're showing across the state of North Dakota. If you're going to extrapolate that as a baseline, maybe a low conservative baseline, because these were areas that were late to where the spread was occurring, you could likely assume that for every person that has been tested with symptoms that's shown up on our list, there's at least another one out there that doesn't have symptoms. And this can make a real difference. And again, when we talk about, saving lives, we know that at least in one case, one of the individuals who had no symptoms, who tested positive, was in a close contact with someone who would be considered to have underlying health conditions due to some recent health conditions. That again probably created an opportunity. That individual with the underlying health conditions tested negative, but now we can separate those two and maybe save a life that way. So that's fantastic. We know that when we're building our models, that this understanding that there could be twice as many people out there as what we're catching that have symptoms, and you can have no symptoms and you can still be a spreader. And if you have no symptoms and you're in contact with a lot of people and not following the rules, that's what you'd be called a super spreader. And that's what we're trying to avoid, because that's where some of these outbreaks in other states have been traced back to asymptomatic people that were not following guidance. So today, switching to the next topic, we want to go to the executive orders. And we have two executive orders. The first executive order today touches on two important organizations, and one of those organizations is our Public Service Commission. And people in North Dakota would likely know that our Public Service Commission is independently elected, 3 members. Currently, those positions are held today by Brian Kraushus, Julie Fedorchuk, and Randy Chrisman. And these folks do the important work that they're doing in citing and permitting infrastructure across our state. Is one of the things they do. When they do that, they hold public hearings. Sometimes those public hearings go on for hours or days. They do a fantastic job of getting input from the public. But now, during this particular time, it's important that we continue to get input from the public, but we do it in a way that protects the public. So in this executive order, it removes the requirement that public hearings are held in specific locations, meaning that they can hold a virtual public hearing. And talking to the Public Service Commission, getting input from them, and with their full support on this, there's actually now, with people working from home, at home, people from a dispersed geography will be able to attend electronically. I think there's a chance where we've seen this happen in other areas over the years, such as when we were doing oil leasing auctions and we went from on-premise to online. We actually increased the number of people that were participating. And so there's a optimism that we might actually be able to increase public participation through this, but this gives them the flexibility to not be required to have a physical specific location and still be able to get that public input. The second one, which is still part of that same executive order, relates to the Land Commissioner. The Land Commissioner reports to the State Land Board. The Land Board is comprised of 5 elected officials: Attorney General Stenjum, Secretary Jager, Treasurer Kelly Schmidt, and Superintendent Baszler, and myself. The Land Commissioner manages all the state lands that are held across the state. Many of you would know that that's at statehood, that was Section 16 and Section 36 in every township. At least in the western half of the state still owns most of those lands, and they're held for public auction. The current way the law writes right now is that there has to be a public auction physically located at the county seat. In today's world of online auctions and broad participation, this is a requirement, piece of red tape that probably could be waived anyway, but we're waiving it right now through executive order. And again, would expect that with all the still required notification and transparency, that we could even maybe get more participation in these. So those are suspending some requirements for the PSC and for the Land Commissioner. We had already issued executive orders on March 30 allowing public meetings and hearings to be conducted by remote means. That was applied to school boards and city commissions, but this takes care of the sections of state law that were specific to the land board and the PSC. The next one we want to talk about, which is an interesting one. Again, these are still things, as you know, we had the executive order a couple weeks ago asking all agencies to identify red tape that we could get rid of. One of the things that came up was that we had agencies and institutions, in this case institutions of higher education underneath the North Dakota University system that had PPE as in personal protective gear, and that could be for food service workers, but we're not serving food in the college. It could be for athletic trainers, but we don't have any athletic teams going on. But turns out there's a lot of PPE, masks, and other equipment in the university system. They wanted to donate it to the health department. Current statute doesn't allow agencies to donate stuff to each other. You have to forfeit it to the surplus equipment team at the state of North Dakota, and then they sell it back to everybody else. So it goes through a process of in and out as opposed to directly. And those rules remain for all other types of equipment, but relative to donations of PPE and medical supplies, we can bypass that, streamline that, and whether it's the North Dakota University system or other agencies that may have PPE, they're now going to be allowed to donate those supplies directly to the Department of Health to be used in our medical cash, which can be used to support the COVID fight across the state. Okay. Next up, more good news, hand sanitizer. We've talked about this. We said we'd be back with some more news. We know this has been in short supply on local store shelves. And of course, as usual, North Dakotans, entrepreneurs, and innovators aren't waiting for others to come up with solutions. Now we are aware there may be more, but we're aware of 4 vendors that are making hand sanitizer in the state. 3 of them are supplying the product for sale to the general public, and you could contact them directly for payment and pickup times. But 2 of those are in Bismarck and Mandan. Dakota Pharmacy on Main in Bismarck is supplying about 200 small bottles a day. You can pick those up, pay for those through the drive-in window. They're also distributing to hospitals, nursing home, and businesses, and they partnered with the local liquor shop, Will Liquors, to obtain the alcohol ingredient. Of course, that's one of the germ-killing aspects of hand sanitizer. Entrepreneurs Marlo and Alice Anderson of Mandan, who are well known for all kinds of great things they do in this community, but certainly known nationally for the National Day Calendar. They're selling sanitizer at their awesome computer repair office at 712 West Main Avenue in Mandan. The ethanol they're using is coming from Red Trail Energy in Richardson. They're producing a lot of sanitizer. And then in Bismarck, teaming up with other companies, Maple River Distillery out of Castleton, in Vigoils LLC, which is an oilseed processing plant, using their facility to make it. So that's what's happening in the western half of the state. In the Red River Valley, there's 2 going on. Red Pine Distillery in Grand Forks, working to fill the needs of facilities that are at highest risk, such as hospitals, clinics, and assisted living, and first responders. If they get their production up, they'll be selling to the general public. But thank you, Red Pine, for serving all of our health care in that area. And then Proof Distillers, which we've mentioned before in downtown Fargo, is producing and selling 300 gallons a week of high and medium quality hand sanitizer. They're getting the new biomass solution out of Grand Forks, supplying 100,000 gallons of high quality ethanol to Proof Artisan Distillers. And you might say, what does ethanol have to do with it? Well, it turns out an ethanol plant is actually just a giant still. It's a way to make alcohol. Receiving bottles from Cass Clay and a company in Wisconsin, so they haven't, but if you've got bottles, save them, because some of this may be in bulk. And we get to learn all kinds of things during a global pandemic, but it turns out that these products are not licensed by FDA or by Food and Drug Administration. They're licensed by the Bureau of Alcohol, Tobacco, and Firearms, because these are primarily alcohol. So if you have questions, call ATF. Okay. But again, great examples and fun North Dakotan entrepreneurs and innovators stepping up to help meet a critical need in supply. Next topic, amended travel quarantine. Given the global pandemic that we're in, it's important that we try to minimize exposure to people who've traveled from places with widespread disease. And that's why we put in over a week ago, our state health officer issued travel quarantine for citizens returning from states on the CDC's widespread COVID-19 list. And this was really aimed at snowbirds, spring breakers, and other travelers that are returning to North Dakota. During this time of year, we are a net in-migration state. There are more people returning to North Dakota than are leaving North Dakota. And that was working well. We heard from lots of snowbirds who came back to North Dakota and were enjoying a couple of weeks at home before they entered their more regular routines. So we thank everybody for that compliance. Yesterday, Minnesota was added to the CDC's list with widespread COVID-19, which raised a lot of questions for residents living along the border, the Red River Valley, anticipating that at some point, if they keep adding people to the list, that we might find that all of our neighboring states are in that. So today we are announcing some amendments to that quarantine to provide more clarity, but these apply to all states because we're anticipating that as this moves on, that every state may have that designation. But first of all, from an exemption standpoint, if you're workers in essential critical infrastructure areas as defined by Homeland Security, they were already exempt. And then others that were exempt, people commuting to and from North Dakota for work or for essential supplies and services. Immediately when Minnesota went on this list, we had all kinds of people saying, hey, I'm a nurse, I live in East Grand Forks, but I work at Altru in Grand Forks. Can I still go to work? Answer is yes. People in Fargo, because they may get their drugs at Walgreens in Moorhead, and they said, hey, can we go to Moorhead? And if we go, can we come back? The answer is yes. So we've also included in here people engaging in outdoor activities such as walking, hiking, biking, running, driving for pleasure, hunting or fishing, going to available parks or other public things. We know that our border cities of Wahpeton, Breckenridge, Fargo, Moorhead, Grand Forks, East Grand Forks, a lot of those trail systems are interconnected with bridges and going back and forth. So if you are going out for a bike ride or a walk with your family and you cross over a park bridge that takes you in a park on the other state and you come back again, that's all exempted. We also have got some questions about out-of-state fishermen. We know that we did close the paddlefish snagging season in northwestern North Dakota at the confluence of the Yellowstone, the Missouri. But as we head into walleye season, and particularly with the great fishery we have around Devil's Lake in particular, and over 400 and some fantastically stocked lakes in North Dakota, we were actually, people that don't fish may not know this, but we have had a lot of people in Minnesota buying North Dakota fishing license the last few years because of the great fishing here. Right now, there's very few out-of-state fishermen coming this early. If we need to reevaluate this, we'll in May. But right now, out-of-state people coming here to fish in our state are exempted from this right now, as long as when they're doing this, they're remaining 6 feet apart. As we've said before, we see people start bunching up on bridges. We'll close fishing on bridges. We see people bunching up at boat ramps. We can close boat ramps. We'll continue to working with the Game and Fish to try to do this on a targeted basis. But the key thing here is using common sense. If you've got a exception to this rule and you say, well, here's my common sense thing, like I live in South Dakota, but our post office is in North Dakota, because we actually have, if you look at the map of zip codes, there are zip code areas where people that live in another state, but they have a zip code. That happens both with South Dakota and Montana. If you have to drive into our state to pick up your mail, that would be considered essential. So the whole point of this is just use common sense, and if you come up with some intricate thing that you think you're being blocked on doing this, let us know, because this is meant to be the common sense order for how we want to manage this with travel. But again, if you are traveling here, coming back, I've been talking about the exemptions, but if you're coming here from a high a state that the CDC is considered a widespread state, and you're coming back from Florida or Arizona, snowbirds still coming back, the 14-day quarantine still applies. No, we're not offering exemptions for that. Next up is we've got a guest speaker today. We're really pleased to have with us Eric Hardmeyer, the Bank of North Dakota, President and CEO. He's going to talk to us on the phone about some of the great work that they're doing. And I want to, again, thank Eric for his leadership. He's been president of the bank, I think, coming on 20 years now. And during that time, the Bank of North Dakota has more than doubled in size. It's had a record, I think, 16 or 17 years of record profitability. Part of the way they've been able to do that is through really managing the cost side. And I think you can see on the slide that one of the ways they've kept the cost down is that they're using Eric's picture from high school graduation as on this slide. But great work, Eric, you and your team. Thank you. And now we'll hear from Eric Hardmeyer, the youthful Eric Hardmeyer.
Well, thank you, Governor Burgum, and good afternoon, everybody. Really appreciate the opportunity to be part of the press conference today. So let me first say that, Bank of North Dakota does have considerable experience financing disaster recovery efforts. We've actually been doing this since 1997 with the flood in Grand Forks, and also as recently as the flood in Minot. We do understand that the scale of this is enormous, but the blueprint that we figured out in terms of financing these, will apply here as well. And we think the first thing that, people should be aware is it is really important to utilize the federal programs. Let them do their job first. The scope and magnitude of these federal programs are of a size that, North Dakota just can't compete with, nor should we. We don't want to duplicate efforts, and the programs that we have seen that come out and support small businesses is, nothing less than impressive. At that point, B&D will assess, our role. As often is the case, there will be gaps. There will be places for the Bank of North Dakota to follow up with. And it really is our intent to come out with a program that will, supplement what the federal programs are doing. So you can look forward to seeing that in the days and weeks to come. Certainly we know that the Bank of North Dakota has a role here. We are the only state-owned bank in the nation, and we are here to serve, North Dakotans, and we'll do so with, all the ability that we have and the experience we have and the relationships that we have with the North Dakota banks out there that help us to deliver these programs every day. One thing that we wanted to announce today is that the Bank of North Dakota is going to provide assistance to the banking community in delivering the payroll protection program. I know that the governor has talked about that in previous press conferences, but of course that is, the liquidity lifeline that the federal government will be providing through loans by SBA and delivered by North Dakota banks. And what we have determined is that there is a role for the Bank of North Dakota to assist these banks as they run into, either liquidity problems, sheer volume, or just risk size that they're not willing to take. The Bank of North Dakota stands ready to purchase, these PPP loans, as they're called. And I think most of you know that this program became available last Friday, and I'm happy to tell you that the North Dakota banks have been getting after this in a way I think that you can feel proud of. The communication between the banks, between the associations has been incredible. SBA has been, challenged by this, but I think that, they've come with every resource they can and are trying to work through the technical issues. As we've worked with the banks across the state, what we have determined is that there is going to be significant interest in this program. Through the first week or so, we are aware that there's up to 4,000 loans that have been or will be processed, totaling just over $1 billion. We think that might be the start of it. This number could grow significantly as more of the technical issues get resolved. And so that's why the Bank of North Dakota has determined that, there is a role for us to play here to help these banks as they want to continue to deliver this program and may run into, as I said, a liquidity or a volume issue. We continue to work with the student loan cohort that has loans with the Bank of North Dakota. Through yesterday, we have worked with over 4,000 borrowers deferring their payments for up to 6 months. We will provide interest rate relief that is coming. And as we compare our program to what the federal program has delivered, we find that our benefit is superior to that of the federal government in terms of our permanent reduction of student loans. And so, Governor, with that, I'd stand for any questions, but just as a kind of a finishing statement, I would say that, we at the bank fully understand and appreciate the unique role that we play in North Dakota and, have our sleeves rolled up and ready to go to work to figure out how it is that we can best serve North Dakota to get us through this really unique, uncertain time. So with that, back to you, Governor.
Thank you, Eric. Thank you and your leadership team for all the great work you're doing. And stick around for the question and answers, which we'll do at the end. But again, we're so fortunate in North Dakota to have an institution that's on such a solid footing and that's got a 100-year history in our state of serving the citizens of North Dakota and has got deep experience with disaster recovery, particularly when we come to this time where so many of the federal programs involve assistance, some of which are delivered through our local community banks. So want to also thank all of the local community banks in North Dakota and all of the banks we have. We have one of the strongest set of banking partnerships if you take our state compared to any other state and take a look at the number of local community banks and the strength of their balance sheets, we're in great shape. And one of the reasons is because of their partnership with the Bank of North Dakota. So thanks, Eric, and your team. Next up, I want to talk about some other business topics. And we've talked about this before, but there's so many opportunities during this time of really, I'll call it financial calamity, to access new programs. But that takes entrepreneurs and innovators whose businesses are closed, got to be entrepreneurs another way and be proactive in another way, which is learning everything you can about these programs. And tomorrow, we're going to have our 4th business briefing tomorrow at 11 a.m. This is a statewide available dial-in. The session is free. You can register at ndchamber.com. We want to thank the sponsors, the Greater North Dakota Chamber. Clear for everybody watching, you do not need to be a Greater North Dakota Chamber member to attend. They're the hosts. We thank them for this, but it's free. And this is an opportunity for us to try to reach everybody in North Dakota. They're helping host it. The Department of Commerce is delivering the content tomorrow. So you'll hear from Michelle Comer, Eric Hardmeyer, and many other folks. 97% of the people that listened last week, 2,200 people dialed in last week. 97% on survey agreed it was agreed or strongly agreed the session was a valuable use of time. Really well organized, well delivered, great content. 1,100 people have registered, so reserve your space now for tomorrow, 11 a.m. Central Time business briefing at ndchamber.com. We want to also talk a little bit about behavioral health, which we do. We've committed to do this at every session. I know that there was an article, I think, that came out in the forum that talked about increase in overdoses. We've talked about this, that the risk of a period of isolation and change with schools closing, businesses closing, layoffs occurring, that this is going to challenge our society as a whole, and human beings are social beings, and our social groups have always been an important part of our identity, and they teach us skills that help us thrive. And feeling socially connected connected is more important than ever. And while we're, again, doing the distancing, the physical distancing, we want to make sure we're maintaining the social connectedness. And staying connected has got a lot of health benefits. Many studies talk about that if you are, connected to others with strong relationships, it improves your quality of life, it boosts your mental health. People live longer, people recover faster from illnesses, decreases our risk of suicide. So many health benefits from that. And this is not just a few. There's over 148 studies with over 300,000 participants indicated that individuals with stronger social relationships had a 50% increase likelihood of survival. This remains true across a number of factors, whether it's age, gender, initial health status, cause of death, etc. So we want to be grateful that we're living in a time of technology where we can connect by virtual means. And again, lots of ideas out there, whether it's on parentslead.org or other places where new forms and new ideas about putting together virtual parties to celebrate birthdays, virtual work together, getting together with friends. Last night I participated in a call with about 25 classmates of mine. They were calling in from all over the world, and it was super interesting and super valuable to learn about what was happening in their world. And again, we can all do that. There's a lot of free products that are out there to allow people to do that. But of course, if you don't want to learn new technology, you can always pick up the telephone, write a letter, leave a note for a neighbor. Those things are all there. I do want to give a shout out to Eli, age 7. That'd be Eli Fox, Chairman Mark Fox. He had a birthday party last Saturday. They're practicing all their good physical distancing, so it was just the mom and dad and the chairman and a brother. But over 300 people sent Eli wishes on Facebook, and he got lots of video, happy birthday songs sung to him. So again, as kids might be grieving because they're missing milestones, important days like birthdays, there's ways we can come with new ways to celebrate that. And again, starting right here in Bismarck, that hashtag World of Hearts, great example of using social media to build connectedness. I think that we saw that it was a phenomenon that started here, sprang up here, spread across the country, and eventually around the world to help create that experience of connectedness as we all go through something challenging we've never been through, and affirming that we're all in this together. And so again, if you want to learn more about social connectedness and ways to connect, again, behavioralhealth.nd.gov/COVID-19. I want to also mention again, just a special note, today on Wednesday of Holy Week, it's critical that we continue practicing physical distancing recommendations and avoiding in-person gathering. I know that many, the vast majority of churches across the state are following this guidance by offering online or virtual resources to include the spiritual support that they're providing for their congregation. And you can find those on your church's website. Go on a Google search. Traditionally, holidays like what's coming up, typically this weekend, there'd have been an Easter holiday with school off on Friday and Monday, and traveling to grandparents, and all of the traditions that people might have had during that time frame. And those traditions are being disrupted this year. But again, I ask people to plan ahead, think about how you can continue to practice that physical distancing in order to keep our communities healthy. And again, with today begins Passover, and tomorrow Monday, Thursday, Friday, Good Friday, Sunday, Easter Sunday. During this time, again, the desire for connectedness is going to be there, but we're at that point, again, where we have not yet faced the steep part of our curve. And again, I would remind people, again, an example I've used before of a funeral that happened in Eastern Canada where people said, it's okay, it's just one funeral, it's really important. 60 people out of a small congregation came down with COVID, including some deaths. So again, it could be a life-saving choice to figure out a way to provide both familial and spiritual support to each other in ways other than in person. Closing topic, or two topics before we close to go to questions. Unemployment update. Yesterday, Tuesday, 1,844 employment claims. That brings us to 42,362 claims since March 16th. There's more data available on the Jobs ND website, but I would include that we've talked about this, again, wanting to get the word out, but it's called the Pandemic Unemployment Assistance. I'm sure it'll turn into an acronym, PUA, but Pandemic Unemployment Assistance, those for self-employed independent contractors and gig workers. That just went live on April 4th. We've had 2,568 of those claims filed, and 624 of those yesterday. So the word is getting out on that. And so again, would want to encourage people that if you in the past thought, hey, I'm not covered by unemployment, you might be today. So check it out at jobsnd.com. Closing with another piece of good news. Yesterday, you were all here, part of the launch of the CARE-19 app. This is an app to help facilitate contact tracing. Contact tracing is the goes hand in glove. As I said yesterday, we've got a quarterback and receiver. You can have a great quarterback like Carson Wentz if you don't have great receivers to throw to. I mean, we can do all the testing we want, but when we find a positive, we need to make sure we're following up with contact tracing to find out who that positive has been in contact with, and make sure that those are being quarantined or being isolated to stop the spread. And the way we can do that is right now, that's a very manual process with people making phone calls. As we've described, some people that work in healthcare are being asked and required by their employers to keep a paper log of who they've been in contact with. So if they ever do test positive, they pull out the paper log and they go, well, here's where I've been and here's where I saw. We've got technology. Anybody that's got a smartphone in their pocket, anybody that's got Google Maps or Apple Maps or any mapping tool on your phone is tracking where you're going. So in an anonymous way within CARE-19, this tracks none of your data. You don't have to provide your own personal information. You don't have to provide a credit card. You don't have to log in. You don't need a password. It anonymously tracks your data. It assigns you a 36-digit random number that is tied to that location data. And if and when down the road you find out that either you're positive or somebody else around you is positive, you're going to be able to use that data to help protect and save lives. And so again, we have 10,205 people have already downloaded the app. We know that, understand just before I came up here, that South Dakota is going to adopt it and go live with this maybe as early as tomorrow. And I know that the Tim Brookins, who was here via phone yesterday online, who's the developer from Proud Crowd, the developer of the Bison Tracker. If those 15,000 people have used the Bison Tracker, you know the kind of app we're talking about. He's already gotten a call from the chief operating officer from the state of Iowa, and I know that Nebraska and Wyoming have also heard about it and are thinking about this as well. So we could see this spreading around. I think there were well, I know there was hundreds of news stories in as far away as the Japan Times wrote a story on this app. So to say that it's going to get interest just in the Midwest, it's already getting international interest because these are the kind of tools that could help us slow the spread in a targeted way as opposed to these broad-based where we have to close down the entire economy. This is a way for us to be very targeted, particularly on the back end as we're coming out of this. The virus will still be around, and we're still going to have positive cases pop up. We're still going to need contact tracing. We're going to need contact tracing all the way through to when we've got a vaccine, and that could be, what, 12 to 18 months from now. So this is not a tool for the next few weeks. This is a tool that could really help the nation navigate its reopening. So excited, and again, thank you to the CARE-19 team and Tim Brookins, Darren Laybourne, Microsoft, Proud Crowd, everybody that worked on that. With that, we'll open for questions. Newsflash, we've apparently answered all questions today, so there'll be we did that great of a job. No, who's going first? Jeremy, Jacob, Tom, Lane. Lane, do I usually go to my left first? Is that what happens usually? Okay, all right. Well, okay. That's weird because usually I would go to the right first, but except for the basketball. People that know me in basketball know that I got a good left hand. So, okay. Okay, Jeremy?
So I was wondering if you could define essential supplies and services as they relate to the amendments to the quarantine order.
The original tool that we used was the Homeland Security list, and we would just refer people to that. Homeland Security's got a list of all the essential services. And when we were talking about the travel, the original travel amendment had exceptions for people in essential services. So, you know, that includes energy, healthcare, agriculture, food, pharmacy, all of that stuff. But
isn't the new amendment to that, isn't that for, I guess that would be for people going across the border for groceries or that sort of thing?
Yeah, it's all the common sense stuff. If you live in a border city and you're coming back and forth and getting groceries or one way or the other, that's all the common sense. But the prior order already encompassed the idea that if you were, well, Minnesota wasn't a hotspot state till yesterday, but it had covered for the fact that if you were coming from a hotspot to be a nurse in North Dakota, you could come and work and didn't have to quarantine for 14 days. If that, in those exceptions where that happened, the providers were testing those people before they put them on the floor. But we did have inbound medical people that were coming from states before, so that's all carried out in the exceptions.
Okay, but just to be clear, it applies now to people who are seeking essential services and supplies now too, not just workers, right?
Yes. Yeah. I mean, if you're a consumer, and you know, like I said, if you're a consumer and your pharmacy is on the North Dakota side and you live in Minnesota or vice versa, you can, you know, fire away. We need to treat the metro areas as effectively as we can as one community, because that's the way it works. So we're not trying to create a barrier where there isn't one along those border cities. We've actually got a town in that's not as well known as Fargo or Grand Forks or Wahpeton, Breckenridge, but I was there last year during the flooding on the Montana, North Dakota border, where the line actually runs down Main Street. So there's actually part of the town is in Montana and part of the town is in North Dakota. This does not apply to, you can go back and forth to either side of that town without that applying. The school was on one side of town, the post office on the other. The school was flying a one state flag, the post office was flying another state flag, but it's the same community. Okay, I think I was going to Jacob.
Governor, around the time there were about 70 to 80 positive cases in North Dakota, you said we should expect that number to jump tenfold in the coming weeks. With the coming weeks now passing and we haven't hit those numbers, is that more of a reflection of the models being used to project, or is that more of a question of the amount of testing in the state?
I think it's a reflection of the fact that great work that North Dakotans are doing to slow the spread. I mean, I think that if you look at, you know, any of the models from 2 or 3 weeks ago, they would have had us into the climbing part of the curve by this part of April. But it's, as you saw today, we're flat right now, and that's a great place for us to be. But it reflects that the strategies are working. Tom, and then Lane.
Governor, lots of chatter on the western part of the state about masks and the possibility of some kind of order. We've got the CDC that has recommended masks now. We've got a sheriff in Riverside County, California, who's saying he's going to arrest people that don't wear a mask. Do you give any appetite at all for an order to wear masks?
I don't have an appetite for an order because I think, again, we don't have enough law enforcement in this state really to take care of the people that are breaking the law, much less, you know, trying to say now we got to police every citizen. I mean, we're not a police state. We're an individual responsibility state. And I would encourage people that, again, if you I would encourage employers, if you've got an employee that's working at a checkout lane in a grocery store and they're seeing 100 people a day, I would make sure they're wearing a mask in addition to the plexiglass. I would make sure that you've got separation so that those carts are 6 feet apart. I would put arrows on the floor and make sure that people are going one way down the aisle and not two ways. I mean, I would do a bunch of common sense stuff that businesses can do. And again, you know, everybody in healthcare has always worn masks. I mean, we've had, you know, dentists back when they were open. They're open now only for emergency. They were always wearing masks. People in healthcare understood the value of masks, and I think that we're understanding now that with the highly contagious nature of this, that masks can be a real deterrent in slowing the spread. And when you slow the spread, then you can, again, save lives. So would encourage encourage people to do that when they're in situations, particularly if they're going to be close to people that are not part of their pod. That's the new word. I mean, if it's your own family unit, so you don't have to wear a mask around the house with the people that you're already exposed to. But if you're coming to work, I would make sure that your coworkers that are going back to their own pods, you're either 6 feet apart from them like we are here, or that you're wearing masks. I mean, that would be common sense for right now, and that is another way, very inexpensive way. Because the one thing about wearing a mask is it's something that you can do that's a courtesy to others, and it doesn't really restrict your freedom. I mean, that's the other thing when I'm talking about using the bike helmet thing on the back side. I mean, having bike helmets as an option for kids saves lives, but it doesn't stop where a kid can bike. I mean, maybe we'd been even more crazy when I was kids in terms of building ramps and jumping if we had helmets. I'm not sure, but maybe it would promote more dangerous activity. But I think that we have we're going to see masks being part of the culture where maybe we thought, hey, that's just something that goes on in China. But I think until there is a vaccine, I mean, there might be a recommendation. Next fall, you might be seeing elderly people with underlying, conditions choosing to wear a mask every time they go out. It might be a smart decision for them if this thing is still, if the virus is still running around in its deadly, uncontrolled fashion. Okay, Lane?
Governor, we were informed that a Bismarck Child Care Center has had multiple providers test positive for COVID-19, and now all of the children that go there are being tested as well. Does this change your stance on keeping the child care centers open?
That's the first I've heard of that, so I know that our Department of Health team and our Human Services team will follow up on that, but it doesn't change our position. I mean, one of the great things, I mean, if there's a blessing in this worldwide pandemic, is that this has been if you're under the age of 20, the mortality rate of this thing is a rounding error around the world, and those cases that have occurred usually have had an underlying health condition. And so, not saying there's zero risk, but this feels a lot more like for the younger generation, this is certainly something that they can get through, and having those child care centers open for critical workers, that's how we keep our healthcare workers, our first responders, and everybody in the workforce to be able to protect those that are most vulnerable. But I say we'll absolutely, when we hear something like that, whether maybe confirming whether there are positives there, we will absolutely be following up. And then that's where we can try to bring the sort of the strike team testing in to make sure people get tested, so that one outbreak doesn't turn into everybody going home and affecting their families, and their families infect their neighbors. I mean, this is why we don't ever want to get complacent, because, we're always one day away from an outbreak here during this time that we're at right now. But, today was a good day, but we have to continue to stay really, really alert in terms of how we're managing this. Dave, and then Jacob.
Yeah, this is for Eric Hardmark.
Okay, great question for Eric. Eric, can you hear us?
Yes, I can hear you, Governor.
Radio legend Dave Thompson has a question for you.
Banking legend Eric. So, Eric, you mentioned that maybe there was some kind of technical issues in terms of rolling out the Paycheck Protection Program. Is it basically, can you describe them in relatively simple terms? Is it problems with applying for it, or is it problems with getting the money out?
Thanks for that question, Dave. No, really the problem has to do with more of a technical system issue with the ability of SBA to handle, 4,000 different banks sending in applications over what they call their E-Trans system. So it was more scale than anything, and it just having to work through some of those bottlenecks. As we understand it, these loans are starting to be processed now at a greater rate, and the money is starting to go out the door. So it's just really a delivery system with a system that had never had to go through that kind of scale before.
Thanks, Eric. And I understand we are having a little technical difficulty with questions online, but so apologize to those media from around the state. But have we got one coming in from Mask Mike?
I do. I have Alan Burt from West County Record asking, why are tests still restricted this far into the pandemic? Why are people not being tested before being quarantined, especially medical staff?
I see it. Mylyn Tufte is here. Mylyn, do you want to come up and answer that one? Or did you catch the question?
So the question about why testing is still limited across the state and the country, it's because we're in a national pandemic and some of the supply chain has been impacted. There's a lot of demand for testing, and we in North Dakota should be fortunate and proud that we have been able to open up testing to so many people. I think the other question that is asked is, are healthcare workers prioritized? And absolutely, healthcare workers are prioritized for testing, and their employers allow them and help them get the testing so that they can return to work and feel safe that they're not spreading disease.
And again, part of that question was the presumption that we had healthcare workers quarantined for 14 days. I had not heard that. If we do, I guess I would ask those healthcare providers to reach out to the Department of Health and let's have a discussion, because we're trying to make sure that we can test healthcare workers and get them back on the front line. But thank you, Mylyn. Tom, then Jacob.
Well, my question's for Eric as well.
Hey, Eric. Great. Back to you, Eric.
So bankers are working overtime. In fact, I was able to get a hold of one banker Sunday night at about 10 o'clock at the bank, which surprised me. Are you saying that Bank of North Dakota is going to be able to help these smaller banks with the overload of paperwork that they have to get these things out?
Yeah, well, thanks for that question. You know, the paperwork that SBA is requiring is not onerous. In fact, they've really streamlined the process to minimize the amount of paperwork coming in and going out that needs to happen. There is some documentation that will need to occur, but, you know, by and large, what SBA has done here, making these, you know, unsecured loans, has really streamlined the process greatly. But where we're able to really help the banks is, you know, some of them, quite frankly, have reached, you know, limits in terms of how many they can do, the volume, the scale, the risk that they're willing to take. And so that's where B&D will come in and help those banks take some of that off of their books and allow them to make more loans and stay within their risk parameters.
Thanks, Eric. Jacob, and then we have another one online.
Governor, you make a lot of sports references. You clearly miss sports, as a lot of us in this room do. And as much fun as it is listening to you talk about NDSU football, my friends and I in Grand Forks are wondering if you have any comments on the prospect of the NHL playing some games in North Dakota. Well,
I think that would be fantastic if that happened. I did see an article the other day that most of the UND hockey team was planning on returning next year. I mean, we talk about Class B a lot, but I mean, I think we had a real shot at bringing home another national championship with a fantastic hockey team they had this year. And so it's great that those folks are coming back again next year, because I know we'd love to have everybody see that group of talented players make a run again. But we certainly have the facility. I mean, we know that the Ingolstadt Center is better than many of the arenas in the NHL, and so I'm assuming that's where you're suggesting they'd be playing. But that would be fun if that would be fun if that could happen. And if we have to go outside, I guess we could pull our own Mystery Alaska kind of a game, outdoor game. All right. Movie reference for people watching. Lane, you're next, then online. Oh, sorry, Mike, were you next? Then online, then Lane.
The hospital in Minot, Gene Shep from Hometown Radio Group, Minot Botno. The hospital in Minot is releasing the number of positive COVID-19 positive patients currently in their hospital. Florida, New York, and Washington State are all releasing COVID cases by city and in many cases down to the zip code. These states are releasing this information no matter how large or how small a community. Clearly, HIPAA is not an issue. Why is North Dakota still not releasing the cases by city, so residents realize it is in their community and realize that they need to work to stop the spread?
Okay, we'll turn that one over to Mylyn, because I know we've been working on this one.
So for us here at the state of North Dakota, we have taken a stance on what information we are we are releasing, because we are entrusted to protect people's safety and the information that they share with us. If the Minot Hospital determines that that's information that they have received approval from their patients to release, that's up to the Minot Hospital. I think the main thing we should all assume and understand is there are people that are asymptomatic that are in your community that do have COVID-19, and we need to make sure that we're not stigmatizing these individuals. We need to make sure that we're good neighbors, and we need to make sure that for us as healthcare professionals that we are entrusted with information that is sensitive and isn't necessarily allowed to be personally identifiable.
And Mylene, also on the zip code question, do we have that up somewhere?
We don't have it up yet.
Don't have it up yet?
We're looking at how we can group that so it's not personally identifiable.
Okay, so we're working on the zip code because we know other states have done zip code, but we've got so few people in some of our zip codes that might actually share too much. So we're taking a look at that, or how we might group those zip codes. But yeah, we want to be as transparent as possibly we can while still protecting data, but I want to, protecting that personal health data, but I want to really emphasize what Mylene said, which is everybody's got to assume that there's COVID everywhere, including those that are not symptomatic, which is what our testing in Western North Dakota on the Operation Drive-In proved, where half the positives came from people that were reporting no symptoms. So assume it's everywhere, act accordingly. We got time for one more? Okay, I got one in the back over here and then back to Lane. I'm going to do two more all the way back over here.
How many of the 735 tests collected at Amidon and Gladstone are included in today's results?
How many of the 735? I was going to try to do, we'll get you that thing. I think we had about, 260 were in yesterday's. Does that sound about right? So does that mean maybe 2 days in a row? So it was spread over 2 days, but we'll get you the information of how they were spread. Lane?
In reference to the Project Drive-Thru, were you surprised to see only 6 positive cases? And with the big turnout, are you planning on expanding that anywhere else in North Dakota?
Not surprised, pleased to see the low number of positives, but also not that we want to find out that there are asymptomatic, meaning people with no symptoms, are out and about, but I think it's a good reminder to all of us that in that case where we did sort of cast a wide net, that half the people that came up positive didn't have symptoms. I think that was good learning for us and anybody else that's building models. Will we do it again? I think where we want to take that, if we have extra testing resource like we did for a couple days last weekend, where we had some more capacity than we had demand coming in from the medical providers, is we want to be able to use that in more of a strike team approach. So if we have a hot spot, we can come in and test a lot of people. Your example of a child care center, if we got a breakout in a rural area, we could move in. If we got discover a positive in a nursing home, like we already had done prior to this, one in Fargo where we tested all 120 residents and 60 staff after a positive, one positive was found. I mean, I think that's another way we want to use that extra resources as kind of a strike team of testing, followed up by contact tracing around there, which again brings us back to, Care 19, Apple App Store, Android coming in a week, download it and help be part of it. Let me close with just a note of gratitude. And again, I think this is something I want to just share, which again, gratitude leads to resilience. And so the note of gratitude here is at a time where I think a lot of people are really locked into their computer screens, and maybe that's because, hey, you're at home, you're working from home, and you got your computer screen, you got TV screens, you got streaming going on, cable channels going on. There is real health benefits to unplugging for a while, and it's really hard to do in the 24 hours news cycle. But I think someone sent me a picture the other day of a crocus trying to pop its way up out of the ground through a little snowbank, and you look outside, I hear more birds chirping every day. I think at this time in North Dakota, in springtime, is always one of optimism. I mean, our agricultural roots in the state get people to start thinking about getting back in the field and getting into the ground and the whole cycle of life that is happening. And I would encourage everybody when you if you unplug for an hour, take a look at the beautiful state of North Dakota. Take a look at the amazing place that we live. And I think what you can add to that is something that I have, which is wonder. Just true wonder and awe about what a beautiful place this is, and with that can also give us the strength and the optimism that know that together that we're going to make it through this. And today was a good day. We're going to have certainly we'll have some more bad days ahead of us, but today was a good one day at a time, with a lot of wonder, a lot of gratitude. That'll help drive our resilience, and we'll get it done. But thank you to everybody in the state that is practicing their individual responsibility and doing it well to save others. So be smart, North Dakota. Stay home, stay healthy, stay connected. Thank you.